Still Alice. It's a 2007 novel by Lisa Genova, a neuroscientist and an author. The novel is about a woman who suffers early onset of Alzheimer's disease. Alice is 50-year-old, a linguistic professor at Columbia University. After she forgets a word during a lecture and becomes lost during a jog on campus, Alice's doctor diagnoses her with early onset of familial Alzheimer's disease. As her disease advances, she becomes unable to give focused lectures and loses her job. She also becomes lost searching for the bathroom in her own vacation home and does not recognize her daughter. She loses the phone and becomes distressed. Husband finds it a month later in the freezer, but Alice thinks it has only been missing for a day. So let's have a look at the disorder in detail. Neurocognitive disorders. Neurocognitive disorders are conditions that lead to impairment of the cognitive functions. Earlier, this condition was known as organic brain syndrome. These disorders mainly occur in the older adults but may affect the younger people too. Neuro is related to the nervous system or the nerves, while cognitive relates to cognition. Although neurocognitive disorders are not psychiatric, they are in the DSM-5 manual. Types. There are three main categories of neurocognitive disorder: delirium, major neurocognitive disorder, and mild neurocognitive disorder. The mild neurocognitive disorder is known as slight cognitive impairment, and major neurocognitive disorder is called full-out dementia. Delirium is characterized by a notable disturbance in attention or awareness and cognitive performance that is significantly altered from one's usual behavior. Disturbances in attention are often manifested as difficulty sustaining, shifting, or focusing attention. Disruption in cognition includes confusion of where they are. Major neurocognitive disorder. It is a new name for dementia. The most significant predictor of developing major neurocognitive disorder is age. This disorder may be caused by a variety of factors noted in DSM-5 as specifiers. These specifiers are Alzheimer's disease, frontotemporal lobar degeneration, Lewy body disease, vascular disease, traumatic brain injury, substance or medication use, HIV, prion disease, Parkinson's disease, Huntington's disease, and other medical conditions. Females have a higher risk of developing a major neurocognitive disorder, especially Alzheimer's disease. Mild neurocognitive disorder. It is a less severe form of major neurocognitive disorder. The difference in symptom is that if you have a mild neurocognitive disorder, there is only a modest cognitive decline from your previous level of performance. If you have a mild neurocognitive disorder, you can still perform daily activities with independence. You can complete your usual complex activities, although they may require more effort than before. Symptoms. Whether diagnosed as mild or major, the mental and behavioral symptoms of the 9 recognized neurocognitive disorders are similar according to the DSM-5 and typically include a decline in thinking skills, presenting as difficulty with planning, an inability to make decisions, trouble focusing on tasks, inability to remember the names of objects and people, struggle with performing daily tasks, speaking or behaving in ways that are not socially accepted, anxiety, memory loss, confusion, headaches, changes in vision, difficulty in walking or balancing. Causes. The most common cause of a neurocognitive disorder is a neurodegenerative disease. Neurodegenerative diseases that can lead to the development of neurocognitive disorder include Alzheimer's disease, Parkinson's disease, Huntington's disease, dementia, prion disease, multiple sclerosis, etc. In people under the age of 60, the neurocognitive disorders are more likely to occur after an injury or infection. The non-degenerative conditions that may cause neurocognitive disorder include a concussion, traumatic brain injury that causes bleeding in the brain or space around the brain, then blood clots, meningitis, encephalitis, septicemia, drug or alcohol abuse, and vitamin deficiency. The risk factors contributing to the neurocognitive disorder. Lifestyle and daily habits. Working in an environment with exposure to heavy metals can greatly increase the risk for neurocognitive disorder. Heavy metals such as lead and mercury can damage the nervous system over time. You are more likely to develop neurocognitive disorder if you are over the age of 60. Then, having a cardiovascular disorder, having diabetes, alcohol or drug abuse, then participating in sports with high risk of head trauma like football and rugby are some common risk factors. Diagnosis. Neurocognitive disorders are not caused by mental disorder. However, many of the symptoms of neurocognitive disorder are similar to those of certain mental disorders, including the schizophrenia, depression, and psychosis. To ensure an accurate diagnosis, healthcare providers will perform various diagnostic tests that can differentiate symptoms of neurocognitive disorder from those of a mental disorder. These tests often include cranial CT scan. These tests uses a series of X-ray images to create images of the skull, brain, sinuses, and eye sockets. It may be used to examine the soft tissues in the brain. Head MRI scan. This imaging test uses powerful magnets and radio waves to produce detailed images of the brain. These pictures can show signs of brain damage. PET scan or positron emission tomography. A PET scan uses a special dye that contains radioactive traces. These traces are injected into a vein and then spread throughout the body, highlighting any damaged areas. EEG or electroencephalogram. An EEG measures the electrical activity in the brain. These tests can help detect any problems associated with this electrical activity. Lumbar puncture. It is a medical procedure that can involve collecting a sample of cerebrospinal fluid. It is the fluid that surrounds your spinal cord and brain. A laboratory can test it for signs of certain medical conditions and infections. Management. Treatment for neurocognitive disorder varies depending on the underlying causes. Certain conditions may only require rest and medication. Neurodegenerative diseases may require different types of therapy. Treatments for neurocognitive disorder may include bed rest to give injuries time to heal, then pain medications to relieve the headache, then antibiotics to clear remaining infections affecting the brain such as meningitis, then surgery to repair any severe brain damage, then deep brain stimulation. It is a neurological surgical procedure. It involves the placement of a medical device called a neurostimulator. Sometimes it is referred as brain pacemaker. It sends electrical impulses through implanted electrodes to specific targets in the brain. Occupational therapy, it helps redevelop everyday skills. Physical therapy to improve strength, coordination, balance, and flexibility. Neurocognitive disorders such as dementia or Alzheimer's present a challenging outlook. This is because there is no cure for those conditions and mental functions steadily get worse over time. Each of these neurocognitive disorder will be discussed in detail in separate videos. So please subscribe the channel. Thank you for watching and keep smiling.